Hi viewers. This month I thought I'll talk a little bit about hair loss, something that I get asked about a fair bit. So firstly, as men we are more likely to get hair loss, and it's quite a common issue. Hair loss can be caused by a lot of different things. I think there are certain health conditions, medications that can cause hair loss. Emotional stress can get hair loss as well. I suppose the commonest cause of hair loss that I see is pretty much male pattern balding, which is just a normal hair loss that we experience, mainly because of the testosterone we have in our system. So there are testosterone receptors in our hair follicles on our head, and because of ongoing exposure to the testosterone, some of these hair follicles start dying off over time. So the first thing to say is that it's worthwhile getting checked to make sure it's not an unusual hair loss and it's just due to male pattern balding. Now, if it's male pattern balding that someone has, then I suppose the question is then how much does it bother you? Obviously, it doesn't bother everyone. For some people, it's fine to lose some hair. A lot of people are happy with a bald head anyway. There's this traditional thing about being bald and virile, more higher testosterone levels. But also, some people feel they feel a bit down about losing hair because it's about their aging, or the hair means much more about their usefulness to them. So I think if it affects you, it's worthwhile talking to someone about it. I suppose the purpose of this talk is to say that basically there are some really well-established treatments for male pattern balding. The common ones, and these are ones that have been tested out, they've been trialed, and so we know that's effective. The first one that's been around for a while is just minoxidil solution, which you can get from the chemist, which actually has been shown to encourage hair growth, definitely. And the second one is a group of drugs, which is finasteride, dutasteride, which block the testosterone receptors on the hair follicles. So they're selective testosterone blockers, so it doesn't block the rest of the effects of testosterone on the rest of your body, so it's just on your scalp. Of course, like all medications, they don't work with everyone, and you could have some associated side effects with it. But these are quite accessible treatments that I think it's worthwhile, if you're concerned about, you can talk to your doctor about and talk about the pros and cons of going on to them. They're not overly expensive, so I think it's worth trying all this before you think about exploring alternative or more expensive options. For some people, where these treatments either do not work or they get unusual side effects, they can't stay on them, then it's probably worth them talking to dermatologists or plastic surgeons about next steps, or thinking about hair pieces, hair transplants, so things that are a bit more advanced. But I think as a first step, if anyone has hair loss, is go to a doctor and check and see if it's a normal hair loss or if it's due to a disease. You could have infections on your scalp or dermatitis in your scalp that causes hair loss that might be treated. If your scalp's healthy and it's just male pattern balding, then have a talk about how much it bothers you and whether you want to do more about it, or you want to be referred on for more help. I hope that was helpful. Bye.